Hello and good day, friends. I hope you can hear me now. Yes, I can hear everybody there. So, hello, ladies and gentlemen, boys and girls. Good day and a very warm welcome to Chai with Vijay Jogia. I'm Vijay Jogia and I'm your host, and I'm logging you into our system. Welcome to this show. Uh, we are now live on Facebook and on YouTube media. The purpose of this show is to invite professionals, and various achievers to come and talk to us about current affairs in the areas of their knowledge and expertise. Our guests are from all over the world, and the subjects we cover in this show span from law, immigration, real estate, sports, health, even Bollywood and any current affairs. Furthermore, ladies and gentlemen, this program is to provide information. Here there is no money exchange nor any financial gains by anyone. There is no discrimination or favorism toward or against any individual or any organization. This program is surely for your entertainment. So without further delay, let me tell you that I'm really excited and I'm as well as delighted to introduce to you our guest tonight. Our guest tonight, friends, has already been with us on the 7th episode of Chai with Vijay Jogia. He is a very talented young doctor as well as a professor at Sydney's Westmead Hospital. He specializes in the diagnostic, oncology, surgical, and cytopathology. I hope I pronounced that correctly, doctor. Welcome again, Doctor. I'd like to invite Dr. And Professor Raghav Sharma to the show. Welcome to the show, Dr. Sharma.
Oh, thank you, Vijay, and thanks for again inviting me.
That's very good, and I'm pleased that you can make it. You could make it, and you have made it today, Professor Sharma. Now I've got a problem here. Shall I address you as Dr. Sharma or Professor Sharma? To me, they are both.
Or you can just call me as Raghav Sharma. That's okay.
Okay, we'll call you Dr. Sharma, right? Dr. Sharma, if you remember last time, we were here about 3 weeks ago, and we were discussing lots of subjects, including the COVID-19 pandemic, together with other health issues and health risks people, especially migrants community, face here in this country and probably everywhere else too. We looked at what we can do and what people can do themselves to help each other. We further looked at very briefly other types of diseases such as diabetics and stroke, heart attacks, brain hemorrhages, and cancer also. We looked at all these subjects very, very briefly. Today, please, I'd like you to do two main things for us. Give us an update on coronavirus, and let's discuss more in details cancer. I know you are a specialist in cancer, and you are very good at that. But let's first go to coronavirus and tell us what's the update since last 3 weeks.
Just to update, Australia has actually done extremely well in what's called leveling the curve. So when it all started in March, we were really in a very difficult position where we might end up like Italy, Spain, or New York. But with governments, the way they basically looked at the whole situation, they've controlled it. At the moment, Australia has about 7,000 cases of which more than 6,500 have recovered. Unfortunately, 103 patients have died. And worldwide, the COVID virus has affected more than 5.5 million people now, with more than 356,000 deaths. So that's a huge amount of deaths because of this virus. So what it tells us is that we really should not let our guards go. While government has to look after the country, they are slowly opening up, and starting June, more and more people will be allowed to meet and do things. But at individual level, at the community level, what I would like to say is that what we have learned over last 3 months, that is what we need to continue doing it, which is take individual responsibility to make sure you are social distancing. So most of the businesses I've noticed are really doing very wonderful job in that they are making sure people are actually following those rules. So they have stickers around the place, they have actually drawn lines where people should stand. I think everyone should actually listen and follow these rules, because just by keeping the distance, you are reducing the risk of, if somebody has the virus, to acquiring it. So about 1.5 to 2.5 meter distance, and making sure you carry, if you have masks with you, do use masks. If you don't have mask, make sure you have the distance, and make sure you use your personal hygiene, all that we have been talking about, alcohol or ethanol based detergents, and clean your hands before you are going into our shops, and
So it looks like we have. Sorry, I lost you for a moment there. Are you back?
okay. Yeah,
Yes.
yeah, I'm. So I was saying that make sure we follow the personal hygiene and the social distancing things that have been taught to everyone over last 3 months, because the danger is the second wave of attack by this virus, and we are going through winter season, which is actually quite conducive to viral infections. So while the northern hemisphere is going into more summer, we are actually going into a winter phase, which is more conducive, where viruses like to grow in a cold environment. So we should not actually think that we are over this infection. Only yesterday, you must have heard that a 30-year-old person in Brisbane has died, the latest
Correct.
victim of COVID virus. So age, it's also affecting younger people as well. So my plea is for people to ensure we have learned all the tricks of how to actually avoid getting this virus. Let's continue doing this. The opening of the places doesn't mean that the virus has gone.
Yeah.
We still have the viruses around. So continue doing that, please.
Yeah, because I mean, even I can see that people are complacent now, and as you said, they shouldn't. But I think that they think that the virus is gone because we're opening. So
Yeah, that's
you're right to say that again. Yeah.
Yeah, that's what I'm trying to re-emphasize. It's very easy for all of us, and we are humans by nature, very social being. We like to mix and mingle, and that is well and good. I would like to do as well. But as a doctor, my responsibility is to just make people aware that we will do those things a bit later on. Let's actually try and help the government. It's trying to get the economy on track. We don't
Yeah.
want to have huge amounts of debt as well. So while government is trying to do that, we have to take this individual responsibility of ensuring hygiene, ensuring social distancing. Make sure in your mind you are still fearful of this thing, because it is not gone. Just to
Yeah.
think that we are hunky dory now and
Mm.
everything is well and good will actually invite the virus back into the community, and we don't want that situation.
Yes. Yes. I totally agree with you. Moving on, then what do you think will happen in 3 months from now, for instance? Oh,
I think the natural course of these kind of illnesses are that they slowly will go away, and we've seen how when you let it loose, we saw what happened in Wuhan province in China. The Chinese died. Same thing happened in Italy,
yeah.
and then Spain, followed by New York. So it has this a natural course of actually killing people, and then
Yes.
slowly it actually gets spread around, and as we see, people are getting, they're still getting infected, but not as many as 2 months ago. But the risk is the countries like Australia, New Zealand, Korea, Canada, for example, have controlled the virus very well. So what it means is we then expose ourselves at risk. The good thing is that we prevented many people getting infected or many people dying even. But because a lot of people don't have immunity, and we are at the risk of actually acquiring this virus and actually forming a big cluster of infection again. So that's why it's very important to keep in mind that the virus can come back. And we've seen history has shown, in different influenza and other kinds of viruses, where second wave of infection comes and it can actually cause really serious consequences. So please still be aware of keeping those simple rules of keeping yourself clean, personal hygiene, keeping the social distancing, try not to mingle too much with people.
Mm.
Let's try and delay it until later part of the year, say October, November, December, hopefully.
Yes.
But
Yes.
next few months, let's keep it actually going online and things like this.
Yes. And what's the situation as far as you know in Fiji? Do we have many cases there?
Fiji, surprisingly, and I'm very happy, has done very well. Actually, Fiji
Mm.
government did an excellent job in preparing itself and trying to control the virus, because we were thinking that Fiji might not get it, even one case. But once that one happened, and then once that guy from his trip to Asia returned, and then he escaped, whatever, and there was a real risk that the virus could have gone out of control. But to isolate that patient, the hospital system did a really remarkable job, taking consideration the health status of Fiji is not as good as here or a Western country. So I'm very impressed, and I think, and at the moment, it's actually really controlled. There's no more new infections coming. So
Mm.
they're doing well. New Zealand has done very well. Most of the
Yes.
island countries within the Pacific have done really good job. So yeah, I think, generally speaking, Oceania region has done pretty well in
Right.
controlling this virus, but we are not actually all out of this
No,
danger.
no, not at all. Not at all. Yeah. So, okay, we'll wait for that. So we continue supporting the government who is trying to fix the economic health of the country, and we have to look after our health and so on, as you said. Now, the good news was yesterday, a day before yesterday or yesterday, that they've developed a vaccine and it's going on trials. That's from the Australian Institute. Uh,
Yeah, so there's a vaccine first. Actually, last week was clinically trial in US on 8 patients. So there is hope. The Australian group is also doing it. There are other groups in Europe also trying their best. The only risk is that the virus, if it doesn't mutate, so there's a
mm,
tendency of viruses to change itself. And
okay.
influenza virus is such a thing. Like every year, we have to get a new vaccine done because the virus keeps changing, the influenza virus. So similarly, there is a worry that if COVID-19 virus also does similar things,
Mm,
then the vaccines will need to be,
you
kept
need it.
on being produced in a manner that is actually protective of that special type or strain of virus. So hopefully it will be out by October, November. Then we could be preventing it happening. But that's still a long way to go. I think at the moment, what is in our control is what we have learned over the last 3 months, which is really effective as well. We have really done very well by simple means of actually controlling something. You can see Australia was really at a danger of actually becoming like one of those other countries, but we control it by very simple means, being government being quite stringent on trying to control the movement of people, number of people meeting each other, making sure the personal hygiene is good. So all these things has been actually really very helpful in controlling this virus, so which is amazing in a way, because this is not very advanced medical science either. This is
Mm.
simple basics of
Yeah.
having proper living. That's all. People, if they do it all the time, hopefully
Mm.
we all have learned from this that we need
Yeah.
to make sure personal hygiene is important. Shaking hands, I think, is gone. It's better to say namaste or some other way of greeting. I think
Yes.
that's gone. We don't really need to go and visit those things again. And trying to keep distance between people when you are speaking, so that the spit and other things are not spread. So a
Mm.
lot of other things has we've learned other things that has come from this.
Yes.
So simple things has controlled this virus, and we can actually win the battle.
Okay. Anything else you want to add on that, or shall we move to the next subject?
Yeah, no,
Uh,
yeah, good. I'm happy as you wish, whatever you
okay.
want to do.
Last week we looked at other all types of diseases, stroke, including stroke, cancer, and brain hemorrhage, and lungs and kidneys, and all those things, related diseases. Let's talk about cancer now. Because of corona virus, people have we are giving less attention to other diseases which are there. Stroke and things are happening every day, and so, what should we do? Uh,
Yeah, I guess being at home has and being health centers, then you couldn't see your doctors, had made a lot of patients quite fearful of the illnesses that they are having and what's happening, because they haven't been tested, the blood test hasn't been done, the other investigations that usually go with following up of different type of diseases people have hasn't been done. Surprisingly, on the other side of the coin, the rest itself, being at home, has been actually in some way, without us realizing, help people control most of the diseases, because otherwise the danger was, and this was a real danger as part of medical professionals, that we might end up getting lines of people who become sick with other things, which
mm,
hasn't really happened. And you know touch wood, it will
that,
be like this. um, and one of the reasons I think why it has happened is because taking rest is very important in our life. Any
right.
kind of disease, illness that you have, your own bit of personal time and resting actually gives the power of your own body, your natural immune system, your other functions that the body does in
Mm,
controlling different types of diseases. So which is not to say that please make sure the telemedicine options that are there, keep in touch with your doctor, don't stop taking your medicine, especially if you've got high blood pressure, if you've got heart attack, you've got had stroke or something, any other thing that is there, make sure you keep taking your medications, keep in touch with your doctor in whatever form you are in. And so far most of us have done quite pretty well with the diseases that they have had. I guess the only risk is patients who have cancer, and unfortunately, they haven't been able to be called into. Although government allowed, that was one of the areas of medicine that was classified as super urgent, and
mm,
patients were allowed to see doctors, and doctors were allowed to do tests and actually treat those patients as well. So hopefully, we haven't had too much of people falling out of the system because of the COVID virus. But cancer is one of those diseases that if we catch them early, we treat them early, the success is good. If it
mm,
is not caught early and the disease progresses, which it does very rapidly, multiplies really millions of times very quickly, and it spreads around, then not much can be done. So I think we are at the stage of now where the systems open, government has allowed doctors to see patients, and there are mechanisms in place now with safety zones that people who are sick, make sure you see your doctors and make sure you get follow up, and whatever treatment is required is all actually being now from next week. All surgeries are happening as well in the hospitals. So the treatment options are there for everyone. So make sure people who are listening, or your families are someone needs some help, make sure you contact your doctor and get your treatment organized.
organized, yeah. And so, let's talk about basic types of cancer in men in women, in both sexes? What are the basic types? If you can educate us on that, please.
So the problem with cancer is actually when you migrate to a country which has high incidence of cancer, anyone migrating to that country actually is at that risk. So while we might not have for generations have had any type of cancer, and we feel that we might be protected because we didn't have, the sheer fact that you are living in Australia or Sydney or in a Western country which has high prevalence of cancers, the risk becomes same for anyone. So the
Mm.
education part is very important. That make sure we all are aware that we are not actually out of the danger zone of getting cancer. And this is what's happening. One of my, experiences over last 20 years in Sydney has been that cancers has been rapidly rising within migrant communities, especially if we are talking about Indian communities. It's actually just as common as any other group, which is the mainstream Australians. So the common cancers are in women, breast cancer, in men, prostate cancer. In both sexes, the cancer of your stomach or your large bowel, it's called, is very common. So three cancers: large bowel cancer or stomach cancer for layman's term is common in both males and females. And I'm sure the government actually sends, as soon as somebody becomes turns 50, they get sent a bowel screening packet. Make sure you do that simple test, which is trying to detect if there's any blood in your stool, which helps us um, in walking up that patient in terms of actually making sure there is no cancer or precancerous lesion. So that is a very simple test, and it is one of those tests we can actually prevent you getting the cancer more aggressive in yourself. Similarly, mammograms and other types of testing methodologies that are there, breast screen, for example, make sure if you've over 50, get a mammogram done, at least as a foundation mammogram. Then thereafter, you should be followed. Men, similarly, if you're over 45, now 50, when you're going to your GP, make sure just ask your GP to do what's called a PSA or prostate specific antigen test.
Mhm.
If you have any change in habit of going to the toilet or something, either number one or number two, both of them needs to be actually talked to a GP about it, so that they're simple tests. These are very simple tests. One is a blood test for PSA, the other is a stool test for blood and things, to start looking for any signs of there could be potential pre-invasive or a cancer forming lesion or a cancer even. So make sure, try and be aware of the risk that we all have, that we are not actually protected. That's what I'm trying to say. Other
Yeah. No,
cancers,
I'm sorry. Sorry to interrupt.
so, so other cancers are like lung cancer. Obviously, if someone is smoking, you are at very high risk of getting lung cancer.
Mm. Mm.
So people who are smoking, make sure, please, if you can stop smoking. It would be a good thing to stop smoking, because our body, it keeps changing on a monthly basis, except for your heart muscle and your brain cells, neurons. All our cells, which about 50 trillion cells in our body, they keep changing.
Right.
So in that way, whatever you do in your life, if you become better with your habits, because the cells are changing, the new cells will have a better environment to grow in. So we can talk about what are the risk factors which cause cancers later on, but try and understand. If you're smoking, if you stop smoking now, you're still making yourself less at risk of getting many different types of cancers, lung cancer being the commonest, heart attack, stroke, gastric ulcer, lots of other things, bladder cancer as well. So stop smoking, please. Otherwise, make sure if they have cough or if there's blood in your, when you're coughing or something, quickly go and see a doctor and make sure you get tested. Because as I keep harping on, the quicker you get picked if you have a disease, the better the chances are that the medical system can help you in terms of actually treating you. So, make sure you look after yourself in that manner.
Right. Yeah. So just I was just thinking, you mentioned that like 30 years ago or 50 or even 70 years ago when our parents were back in India, my parents migrated from India to Africa. Yours came here to Fiji from India. So in those at that period of time, I don't think people knew about cancer. They didn't know about all these other diseases, and now we are just in the Western society, and we see all these things happening. What do you say to that?
Sadly, part of the industrialization is one of these kind of things happening. Before, what we used to have about 100 years ago were infective things. Like we didn't have good sanitation, we had poverty and other things. So infections was the problem. So you could get lots of dengue fever like diseases or typhoid or bacteria or virus or fungus. Viruses still happen. COVID has again come. So, but that time, at that period of our civilization, infective diseases were actually a major problem and killing a lot of people as well. And people used to have very low life expectancy, because once you got an infection, if you don't have antibiotics and other things, you will be killed. And that used to happen very commonly. So the magic came as soon as we developed antibiotics around 1930s, sulfonamides or penicillins and other things. It was like a magic, truly like a magic bullet. We've actually been able to control most of the bacterial, fungal, and other types of infections. What we still don't very well control is like viral infections like COVID. That's why it's a problem. But most of the bacterial infections has been quite well controlled. But as the world progressed in terms of development, which is industrialization, the lifestyle started changing. We probably humans were meant to be farm-based people, working hard, hard labor, eating organic stuff fresh from the farm. So in that is probably the ideal diet for the body, and it protects you by balancing the immune cells, other chemical mediators, and your physiology and the system that this body is when you have that kind of diet. But when as the world became more modernized, we started changing the way we were eating. And this has followed from, say, USA, UK, Australia, New Zealand, then Fiji. So about 20 years behind each of these countries has been in terms of actually bringing those kind of diseases from these countries. So heart attacks and other things became more common in UK, USA, Australia, New Zealand, before it came to, say, Fiji or India or Africa or Asia, because there's a lag period as part of industrialization. As people change their lifestyle in terms of leaving their hard working, labor based professions, being a farmer, to living in a shanty little town near Suva or Nasinu or in Bombay or somewhere, where you really are struggling for a small job, but you don't get enough exercise. You are now don't have fresh food. You are difficult. You have all these issues of actually having a good diet. So the body then starts developing these kind of diseases, which are called non-communicable diseases, or diseases which happen because our body system is changing. So the typical diseases are diabetes, which started happening in Indians, say around late 70s, early 80s. Um, and now the native Fijians and Pacific Islanders and other people are getting it 20 years, probably 15 years after Indians had that. It's just because the Indians were more exposed to change in lifestyle more earlier than the native people. So it just, as your diet changes, as your lifestyle changes, as you are living more sedentary and not so much exercise, eating too much of refined food, too much sugary food, too much of fat which is altered and not prepared in an organic manner, all this adds up into disrupting our normal body system, and diabetes, then high blood pressure, which leads to complications, which is called brain hemorrhage or stroke or heart
Mm.
attack, or your eye problems. So many complications of that. The most serious complication of changing the lifestyle is cancer, if it
Mhm.
makes sense. I tried to spend some time to explain why cancers happen is actually those similar kind of risk factors, similar changes that we have brought. But as the body becomes weaker or more defunct because of all other diseases like
Mm.
diabetes, hypertension, renal disease, our immune system is not as strong anymore, and cancer cells have more tendency to develop. Not that cancer cells were not happening 50, 60, 70 years ago. They were actually, because if our body has 50 trillion cells, they replicate. The chances of randomly getting a cancer cell is very common. But the body's own protective mechanism used to be much better before. The immune system, the army of cells that we had, were able to remove those cells very quickly from our body. So we never developed, say, cancer. But now, with stress, with obesity, with changed lifestyle, with other secondary diseases that we have, our immune system, the networking is not as crystal clear or as good to remove those defunct or negative cells which can potentially become cancer from our body. And then on top of that, we are utilizing things in terms of lots of alcohol,
Yeah.
lots of fatty food which is actually altered, not organic way prepared, like a traditional ghee. The way it was prepared
Mhm.
was not harmful to the body, but the way it's refined and prepared, the fat that we are eating is very different. Same with coconut oil. When it was produced in a very virgin manner at a home level, it has a different effect on your body. But when it is mass produced in a chemical factory, its impact on your body is different. So all these multiple factors actually have joined to make us predisposed to different types of cancer. And as I said, when you migrate to a country like this, our women, we all of us are equally at risk of developing cancers, like I mentioned, breast or prostate or colon or stomach or lung.
Mhm. Right. So thank you so much in explaining all that to us. I'm sure many listeners will find that very, very helpful. Um, so to summarize, what can a normal person do, right? So would I be right in saying that if I'm a normal person, we should make it aware to people cancer by joining, societies like Cancer Council and all those people. Talk to friends, talk to family about have discussions on all these diseases, and kind of programs such as these, such as shows like these, just to build up people's awareness. Would that be kind of right thing to do?
Yes, and that's why I'm actually was most happy to come and chat with you, because I can't give this information otherwise. But through your medium, I can let people aware, because awareness is the most important thing. Our habits form because of what we do most of the day, which is watching TV and reading newspaper and things, and we just subconsciously fall in a trap of doing whatever is happening around us. Very little of what is very serious to our body is not taught.
Yes.
Fortunately, COVID has made us think about health. It has actually drawn the attention of everyone, whole world, to the status of health that a country has, or the status of health the individual has. Suddenly, it has come in the forefront, and I'm trying to take that time now in space, which has built this interest in the community and public at large, to just make them more aware that no, while COVID will go away, the other illnesses are not going to go away,
Mm.
because that lifestyle, we are going to get back to it very rapidly, very quickly back into it, which is very stressful, which is high demanding, because you have huge amount of mortgage, you have lots of responsibilities. You'll go back into that situation, and guess what? Your body suffers. And when body suffers, then it becomes actually weak enough to allow things like cancers and other diseases to happen. So eh, I guess the time is opportune for you to actually make people aware. Let's talk more about these things. We shouldn't be scared of cancer. We used to be very, very, it was a word which people really felt bad about talking, even, in most migrant groups. And still, I
Yes.
see people hesitate to talk. We have to talk about it because it is going to affect someone we know or someone in our family. It's
Mhm.
all around us. So talk about it. Don't be so scared. There are medical mechanisms in place which will look after you. So while this generation or maybe the next generation probably can't correct its body so rapidly to be back into protective way to prevent a lot of these diseases, we will go through these things. Our
Yes.
only hope is to actually pick these things very early. The earliest we pick, the most likely is that you would be treated. So
Right.
that's our best bet. Not
Okay.
to say that please don't just give up like that and be a defeatist. No, change your lifestyle. Try and incorporate what you have done over the last 2 months because of COVID. A lot of exercises, bit of jogging around, walking around, a lot of good rest to your body, good sleep. So body gets actually recharged itself. So
Mhm.
learn from this and increase your awareness of different types of diseases we mentioned. If there is any issue, anything, any change in bowel habits, change in your urinary pattern, you are coughing too much, have too much pain in the tummy somewhere, you aren't feeling well, you are losing weight rapidly without any explanation, make sure see a doctor, get the test done, and our aim is to actually pick these things quickly and treat them because that's when we can treat them.
Okay, doctor. Well, thank you so much on that subject. Just move on a lighter note. We only got like 5 minutes or so.
So,
Uh, but on a lighter note, I mean, you are so active in a lot of things. Yeah, yeah. Obviously, you are a general health practitioner and an expert on cancer and other things. You teach yoga. You teach Ayurvedic medicine plus other things. How do you manage this? How do you keep yourself away from stress? That'll be.
yeah, I think one of the ways, I think 24 hours is long time in a day. If we are able to utilize the time, which we all should do, not saying that stress yourself without actually being considerate of what you are doing, but planning your life, your day well is very important. One of the first things, my advice is for people to learn wake up early in life.
Mhm.
Your day is much better in terms of functioning if you wake up early. So I usually wake up around, I mean, I don't want to say, but sometimes 3:30, 4 o'clock.
Is that
But
right?
at least if you can wake around 5 o'clock or 5:30 and get your day sorted out in terms of planning it, what you want to do whole day, it works out much better. So sleeping in is not good for your body as well because our endocrine system, which regulates most of the functions of the body, is directly related to sun. So sun's motion causes secretions of different chemical mediators and good cells in our good stuff in our body, which are called hormones. So so waking up with sun and trying to do things works two ways. It helps you function better, plus it helps your body be much more tuned to what you are supposed to do whole day. And try and go to bed around 10:30 or 11 at most, so that you have a good cycle where we are rotating on a sun, on earth, which is going around sun. We are actually part of this cycle of universe, and we have to respect that. We can't actually go against it. When you start doing things against that, then your body is actually suffering. So one of the first thing is to learn to wake up early. I teach, I mean, because of COVID, we can't do it at a one-to-one level, but online, if people are interested, I still, do yoga. I teach yoga because all the things that I mentioned, when we were talking about taking good care of your health, actually can be very well done by practicing yoga. Yoga includes physical asanas where you get exercises, all those things, good for your muscles, good your lymphatic, your plumbing system of your body, removes toxins and things of your body. It helps with your breathing exercise. Most of us don't know how to breathe properly.
Right.
All our cells require oxygen. So if you learn how to breathe properly, deeply, you are going to help your body become much more powerful, and your mind functions better. So you are able to produce a better day in terms of your work output, etc. as well. And thirdly, your emotional system, which is a major part of a human being, needs to be balanced as well. We don't live in with the grandpa parents, uncles and aunties anymore, because then they were the ones who took our stress by being around us. We are left
Mm,
alone now,
mm,
so we don't have that kind of support. But doing a practice like, something you mentioned, that I do yoga, so I'm mentioning it. Otherwise, everyone has their own little way of doing it. Go for a jog, go for a walk, do some stretching. But yoga in itself actually includes all these things, so you get a good emotional balance as well. So you are more realistic of life in terms of understanding yourself much better. You are more intuitive, so you see as yourself much more, in terms of being in control rather than being dependent on everyone else what they are saying, which is really harmful to our body. So that's another matter we can talk sometime later on. But just to conclude, I would say incorporate good habits in your lifestyle. Sleeping, what do you put in your mouth, what do you eat? It's very easy for people to judge others and be very judgmental as to other people are bad in terms of what they eat or not. But what are you doing? So make sure you are aware of what you put in your mouth, because your body has just one formula or one module in which it actually digests the food. So being aware of what we are eating, what we are doing, is very important. It will balance our life. What we
right.
have lost by migrating from our hometown and things can be balanced by just being little aware of our daily activities, rather than subconsciously just following whatever is happening on TV. I think that is where we've got it wrong. We need to get back a little bit and then try and balance our life in a bigger manner. It will be beneficial for you in a different levels: your health, your mind, also your emotions.
Dr. Saab, Professor Sahab, thank you so much. You've given us so much information. I can't wait to go and try out what you said about this yoga and things. So uh, watch this space. I'll let you know what's happening. I would like to make another request that when we get you again next time, we want to talk to you more about stroke and things related to stroke. If you can give that more emphasis, then that would be
Yes.
nice, because it's a very important disease. And so we'll, if that's fine. And the other thing is, I hope you don't mind, we get lots of questions from
Yeah,
our
yeah.
viewers. I'll forward them to you, and about that's it. We've done our time, and sadly we have come to the end of episode Chai with Vijay Jogia, and now we have Dr. Ragwa Sharma. Thank you so much for your valuable time. And also, I like to thank our audience for watching us. And I like to thank our audience overseas for watching us. And I like to thank Facebook and YouTube for providing us this service. Uh, and I like to invite people. I like to invite any people from any profession, an expert who can come and talk to us about their knowledge with us, and let us know if they like to come onto our show. Sharma, by Dr. Saab.
Thank you all. Thank you.